Welcome. Today we're going to talk about a childhood mental disorder called autism spectrum. Autism spectrum disorder manifests in early childhood and is characterized by qualitative abnormalities in social interaction, communication, both verbal and non-verbal, and repetitive or stereotype behaviors. What are the causes of autism spectrum disorders? The causes are known. The hypotheses include genetic abnormalities that have been found in these individuals with autism, obstetric complication. That's why it's very, very important to have good obstetric care. Things like birth trauma affect these individuals and are risk factors for autism. Exposure to toxic agents, prenatal, perinatal, and postnatal infections all are risk factors for autism. How does autism present? One of the things we notice is developmental regression. We have a child who has been growing normally. They started crawling, they started having a monosyllabic speech, one word, but all of a sudden they regressed. They're no longer able to crawl and talk. Absence of proto-declarative pointing. These are things you need to look out for. When a child wants something, they usually use their index finger to point at it. If you notice that a child is not able to actually do that, that's one of the signs. These children are having abnormal reaction to environmental stimuli. You'll find normally when a child is in a noisy place, they tend to be irritated and agitated, but these individuals may not react at all to a noisy environment, or they react abnormally, what's not expected in the environment of the child. Abnormal social interaction. You find a child lacks a social smile even when greeted by parents. Find this child mostly when you try to play with a child and smile with them, they tend to reciprocate and smile back. Find these individuals are not able to do that. Language delay. That's one of the commonest presentation that most mothers come with. They come and say, my child is not able to talk, yet the other child was able to talk. Absence of symbolic play. Normally children, when they are playing, they tend to use symbols, arrange their toys in a certain way, or imitate people. Repetitive stereotype behaviors. You find these children having things like playing with their toys in a specific way, having a special arrangement of their toys, head banging, and having anger tantrums. But how do we manage autism spectrum disorders? To begin with, there is no blood study that diagnoses it. But we can do certain studies to help us to diagnose the comorbid illnesses. Tests like the electroencephalogram to look at the brain, how this electric activity is in the brain, as most of the times children with autism tend to present with epilepsy as a comorbid illness. Other brain imaging investigations like a CT scan and MRI can also help. But it's important to notice that there is no blood test you can go to get to make the diagnosis of autism. It is made from taking history. So the basis of management of autism is non-pharmacological, and it involves a multidisciplinary team. To begin with, we have to psychoeducate the parents, the caregivers about the disorder. After we've taught them about the disorder, we involve the multidisciplinary team that will include the speech and language therapist. This will come in to help in teaching the child how to speak. Occupational therapists. These will come in to help the children to be able to do activities of daily living. Social skills training. The therapists come in to teach them how to do various social skills. No medication is effective in treating core behavior problems. Very important to notice that there's no medication that is effective in treating the core behavior problems. However, some medication may be effective in treating other behavior problems like injurious behaviors and aggression. In the next episode, we shall talk about another childhood mental disorder called attention deficit hyperactivity disorder. Thank you for watching and prioritizing your mental health.